acoustic voice analysis and maximum phonation time in relation to Voice Handicap Index score and larynx disease. Via ScienceDirect publication, Journal of Voice. Publication date, available online August 6, 2018. Source, Journal of Voice. Authors, Tom Karlsen, Lorentz Sandvik, John-Helge Heimdal, Hans-Jørgen Aarstad. Abstract. Objectives. Patients with voice-related disorders are ideally treated by a multidisciplinary team. Acoustic voice analysis and patient-reported outcome measures are recommended parts of the clinical assessment. The present paper aims at further documenting the importance of acoustic voice analyses, maximum phonation time, (MPT), and Voice Handicap Index, (VHI), into clinical investigations. Study design. The participants, N equals 80 larynx cancer, N equals 32 recurrent palsy, N equals 23 dysfunctional, N equals 75 degenerative, inflammation, N equals 19 various excluded, were included consecutively at the outpatient laryngology clinic at Auckland University Hospital. In addition, a control group of 98 healthy subjects were included. Method. Voice samples, MPT, and the VHI scores in addition to standard clinical information were obtained. Acoustic analyses were performed from these samples determining level of jitter, shimmer and noise to harmonic ratio, NHR, as well as analyzing frequency of a prolonged vowel. Results. Jitter, shimmer, and NHR scores correlated strongly, R 0.8, P 0.001, to each other. By analysis of variance analyses, we have determined significant dependence on diagnostic group analyzing all the obtained acoustic scores, all P 0.001. All patient groups but the dysfunctional group scored to some extent worse than the control group, mostly at P 0.001. In addition, jitter scores from dysfunction group were lower than recurrent palsy group, P 0.05. And shimmer scores were lower among dysfunctional than the cancer group, P 0.05. Regarding NHR, the cancer patients scored higher than the degenerative, inflammatory group, P 0.05. The cancer group scored with longer MPT than the degenerative, inflammatory, P 0.001, and recurrent palsy groups, P 0.05. Conclusion. Among larynx disease patients, acoustic and MPT analyses segregated with all determined analyses between patients and control conditions except the dysfunctional group, but also to some extent between various patient groups. VHI scores correlated to jitter, shimmer and NHR scores among cancer and degenerative, inflammatory disease patients. Acoustic analyses potentially add information useful to laryngological patient studies. Add tags, currently, swallowing and swallowing disorders, dysphagia, #medicine by Alexandros Sfakianakis, #o.r.l. Sfakianakis, #e.n.t, #ola by Sfakianakis G. Alexandros.